absorption, you already know, we have done the absorption also. The absorption of carbohydrate happens, and you know which part of intestine? Duodenum and jejunum. Duodenum and jejunum, not ileum. So up to jejunum, all carbohydrates are absorbed. So duodenum and jejunum are dedicated for absorption of carbohydrates. Here what will happen? The monosaccharides are absorbed by intestine, and actually galactose and glucose both are absorbed the same way. Even galactose absorption is more faster. It is faster. Galactose absorption is faster than glucose absorption. But both are absorbed same way. But fructose is absorbed a different way. Fructose is absorbed by facilitated, F for fructose, F for facilitated diffusion, by GLUT 5. Fructose facilitated and 5. So remember, GLUT 5, fructose facilitated. And these two, galactose and glucose, they are absorbed by secondary active transport. Secondary active, when I tell you active transport, when somewhere you see active transport, that means it requires energy. And when there is secondary, that means indirect ATP utilization, indirect energy utilization. So the transport happens through indirect energy utilization. How does it happen? Through indirect energy utilization. So you can see this. So this glucose transportation happens through a transporter called S-GLUT. This is sodium dependent. S means sodium dependent glucose transporter, S-GLUT. This sodium dependent glucose transporter is our membrane protein, which are present on brush border and help in absorption of this glucose through symport. One molecule of glucose and one molecule is sodium absorbed together. This is called symport. And this symport is driven by ATP utilization by sodium potassium ATPase that is present on the blood, on this basal epithelium, which is facing blood vessel. So this basal membrane of this epithelium has sodium potassium pump, sodium potassium ATPase pump. And this sodium potassium ATPase pump, what does it do? It takes 2 potassium inside and throw 3 sodium outside. This is the property of this: 3 sodium outside, 2 potassium inside. So because it throws the sodium outside, it throws the sodium outside. Because of this, what will happen? There is sodium vacuum. Remember, sodium vacuum inside. Okay, because of this sodium vacuum, the sodium that is present out there in the lumen will be sucked. The suction pressure will act on this sodium. So because of this sucking action of sodium, with sodium, glucose will also be. So this is how ATP is utilized here to create a potential gradient for sodium. Okay, ATP is utilized here to create potential gradient for sodium. ATP is not utilized. Because of that potential gradient, this sodium sucked, and along with sodium, glucose is absorbed. Did you get this secondary active transport?
Yes, sir.
It is the revision. You can see this in this picture. Sodium potassium ATPase throws this sodium outside the create sodium vacuum. You can see sodium vacuum. Okay, this sodium vacuum will suck the sodium. Along with sodium, this will also be sucked. So because of this ATP utilization, this is driven. This molecule does not utilize ATP. That is why secondary. The ATP utilized by somebody else, and because of that, the transport becomes active. If this is not there, there will not be transportation. So this is active secondary active transportation of this sodium plus glucose together, and this is called S-GLUT transporter. And I will tell you, this is not a simple thing to understand. Actually, this is easy to understand, but once you understand, This principle is utilized also for absorption of amino acid. You know, you replace glucose when we study amino acid absorption. You replace this glucose with amino acid. Though protein will be different, but the same principle work there also. So understanding of this simple secondary active transport at one place will help you understand many things. So this is not a simple thing. If you understand one thing, you understand many things. So you have to be that, though it seems to be one slide, but it has very big impact. That is why this secondary active transport becomes very, very important to understand. And this is a favorite thing to be asked in your exam. Because simple one thing, you understand one thing, you apply in many domains. You apply for amino acid absorption also, you apply for glucose absorption also. Most of the amino acid absorb the same way glucose is absorbed. Okay, remember this through secondary active transport. Now this is the frequently asked question. So why is, and you can see in ORS, you will see there is actually the patient which has dehydration requires sodium, but sodium will only not be absorbed. Along with sodium, you need to supplement glucose also. So that is why this ORS has equimolar amount, not actually sodium has 23 weight. Okay, it has got weight, molecular weight 23. Glucose has 180. So this weight, molecular weight is different, but that is why it requires 20 gram. It requires this. If you divide this 5 with this 23, and if you divide this 20 with this 180, it will come like 1 point something, maybe 1.3. This will also come 1.3, 1.1 or 1.3 like that. So the equimolar amount of sodium, equal molecule of sodium and this glucose has to be given in ORS formulation, because these are absorbed together. These are absorbed together. So though weight seems different because the molecular weight is different, that is why weight is different. But molecule number of molecule is same, almost same. So you can see that is why 20 gram here, because 180 gram molecular weight here, 3.5 gram because the molecular weight is 23. So this is how equimolar amount of this sodium and glucose is formulated. And other minerals can be added, potassium, and this is added to that supplement, because potassium will be absorbed by its own, and citrate, they are absorbed by its own, and these two are very important. This is the reason for formulation. This is the absorption, the method of absorption of sodium and glucose together. This is through synport is the reason for this formulation. Okay, ORS formulation.